All right. So my name is Venecia, and I am a doctoral student in the Counselor Education and Supervision program. I actually got my master's degree from TCS, and I was in the same program that y'all are in, the CMHC program. I was a part of the second cohort that graduated. So I graduated in December 2017. So I was like one of those first guinea pigs that got it all started. My experience was really amazing. And so now I live in Dallas, Texas, where I'm from, born and raised. And I'm currently working in a substance use facility, and I'm still working on my hours to be fully licensed. And so right now in Texas, originally I was an LPC intern, and now they've changed it over to us being LPC associates. And so I'm projecting that in April, I'll be done with my hours. So fingers crossed, I'll be done in April, maybe before then. I don't know. But hey, something for y'all to look forward to because there is a light at the end of the tunnel. Um, so for me with therapy, I'm really more CBT based. But then, like, after doing research on solution focused therapy, I also mix that into my practice as well, which I didn't realize it because it's always talked about, but there's never like a name actually put with it. So when I actually did the research, the little bit of research that I did, I was like, okay, I actually already use some of this stuff. So it's like, yay, I already use it. And I really find that it's important because a lot of times when you're dealing with crisis situations or somebody who's just like, I need to find an answer, this is really one of those theories that you can go to, that it can literally be like your go-to. And I've literally had to use this with people that were in like crisis situations where they were like, right now I don't know what to do. I'm really trying to find an answer. And so it was like, okay, what would it look, and then just asking all those different questions to get them to actually find their own solution. Um, and so tonight, I'm going to be doing a little bit of teaching. It's my first time, so don't be too hard on me. But I do want y'all to know that y'all are not being graded or evaluated in any kind of way. This is for my grade and for my evaluation. So it's all me, not you. So don't be nervous about what you say or anything you do because it totally doesn't matter. Right now, it's just, I mean, it does matter, but y'all not gonna like be graded for this or anything like that. So with that being said, let's go ahead and get started. So, Tiana, are you driving right now?
Yes, but I'll be parked in 3 minutes.
Oh,
perfect. Okay, awesome. Because I have a
Venecia,
game.
well, I thought it might be helpful before we move into the game to hear, and we can spend before she parks, hear from them to hear what where they're at in the program, so we know kind of where they're at, theories, techniques, like how far they are, and hear from them. So
yeah, perfect.
That's okay.
Mm-hmm.
So
yeah,
Tiana,
perfect.
yeah, and whoever wants to go first, and just to introduce yourself, I'd love to hear name, where you're at in the program, and maybe where you are. I'd love to hear from you both.
Okay, I can go first. Oh, no, someone else going? So my name is Tiana Davis Sassu. This is my very first year in the program. It's only my second class. So I'm very new to almost everything. Even when the acronyms are being used, I'm trying to like figure out from my readings like what you possibly could be talking about. So theories is a class right now, and we're only a few weeks in. So I'm very new to all of it. So I'm excited to be here so that I could kind of, put some of what you're talking about to what we're learning about in class as well.
Yeah. Oh, this will definitely help.
Yeah. Tiana, have you taken theories yet? Or are you taking theories now?
She said she's taking it right now.
Oh, okay. Sorry. Right now.
Yeah. So she's only in like the third week. So she
Yeah.
hasn't even
Good for
touched
you.
into any of it. So yes, I will tell you now, what you're gonna get today
Yeah,
is
none of
going
it.
to help you so much. Like it's literally gonna help you, because once you get to talking
Okay.
about this theory, you'll be like, oh yeah, I already know. And it really is a pretty simple theory.
Well, hi everyone. My name is Andrea. So this was literally posted today. So I just want to drop in. I
Okay.
probably won't stay the full
Yeah.
time because I just kind of wanted to see what
Okay.
it was
It's a lot of
about.
information.
I'm sorry. So I just want to see what it was about. I am in the CES doctoral program. So I was just dropping in. Yeah. Yeah, so when I heard, I'm a solution focus oriented, like that's my theory of choice. So when I saw it, I was just like, okay, let me go ahead and tune in just to kind of hear what was going on, because I love just, learning and, obtaining more value of anything additionally that I might need to know. So that's why I just decided to pop in real quick. Just to kind of support and to listen. But I just want to let you know, I won't stay the full time, but I just want to jump on in here just to kind of support and listen. And hear the conversation.
Yeah, so literally, I was looking at your name and I was like, I know that name. But then you said we're in the same program. I'm like, yep,
Yes.
that's her. So I'm like, girl.
Hi.
All right, and we've had somebody else to join us, Miss Tina Ward.
Hi, hi everyone. Kind of forgive me. I have stitches in my mouth. I had oral surgery.
Oh.
So I just wanted to drop in and kind of learn, because I am one that tries to, or it seems like I operate from a place of collaborative or integrative approaches, if you will, depending on my client. I'm a chaplain by profession, so I found where, crossing over into this profession is causing me to kind of just look at a lot of the theories and based on the client need. And so I just wanted to kind of log on and just kind of hear and learn. Of course, I'm always trying to take advantage of opportunities to learn, especially when platforms are available to us.
Okay, awesome. And so where are you in the program?
So I'm in my last course, and I enter practicum January. And actually, I did practicum readiness, and I'm already a part of the VCTC, where I am conducting groups and providing some one-on-one and things of that sort. So, yep.
Awesome.
Okay, well, hopefully, after this, you'll go with having another theory that you can apply.
Yeah, looking forward to it. Thank you.
And we had somebody else join us, Ty Talbert.
Sorry, we're doing some brief introductions. Just wanted to see if you're available to speak, and I don't want to, as far as your name and where you're at in the program.
Oh, hi. I didn't know we had to speak. Sorry.
Yeah.
I am actually ordering food right now.
Okay.
So my name is Ty Tolbert. I am an incoming student. In fact, this is my second semester, and I live in Louisiana. So did I miss anything else?
Nope, you have not missed anything. We were just doing introductions. So are you taking the theories course right now? It's okay. Are you taking the theories course right now?
I am in 507.
Okay, the theories course. Okay. So you and Tiana are in the same boat right now. All right, awesome. I think that's amazing. And so especially for Tiana and Ty, for y'all to be super fresh and super new, y'all are definitely gonna hopefully learn something and take something away and be able to go back and tell your professor, oh, we learned about this, and this is what I know. And we have somebody else coming in. What?
Good thing we waited a few minutes, because this is trickling in.
Because they just come in. I love it.
All
Makes it better for me.
Yeah.
All right, so we have Grace Hawkins.
As soon as people come in, they're like, all right, speak.
No, go ahead and no, Grace, unmute yourself and just tell us your name, where you are in the program, and where you're from.
Yeah.
Hi, I am Grace Hockenberry. I know my name is a little longer.
Right.
I am in my last term of classes before I start fieldwork, and I am in Orlando, Florida.
Very awesome. Yay.
Cool. All right.
Nice.
So we have a range here tonight of first semester and practice and internship stage.
Yeah.
And so this is great. Go ahead.
Yes, this is awesome. All right, so I'll just go through again and introduce myself really quick. My name is Venecia, and I am a doctoral student with the Counselor Education and Supervision program. I did graduate from the CMHC program December 2017. I was a part of the second cohort that graduated. So I totally know where every single one of you are, and I totally understand it. But just know there's a light at the end of the tunnel, and trust me, you'll get through it. So I'm very excited to be here to co-teach with Dr. Clark. And I really do hope that through this, you all will leave with another theory that you can kind of put in your theory bag to help your future clients.
Yeah, just for those of you who came in real quick, Dr. Cory Clark, core faculty with the CMHC online program. I teach a bunch of different classes, but my specialty is counseling kids and teens. I work almost exclusively with those populations, work with young kids, a lot with teenagers these days though. And so with that, I do a lot of solution-focused work and focus on the future and how people can make meaning of it. So I integrate existential quite a bit. But yeah, if at any point you want to pick my brain or talk about that field of counseling kids and teens, I'm always available. So reach out. So I'll hand it back over to Venecia.
All right, and also I did forget to mention, I work with individuals with substance use and addiction issues. So that's kind of been where I've been at, but I'm hoping to kind of flow into working with children and adolescents. But yeah, if you all have questions with working with individuals with substance use issues and addiction issues, totally open to it. And so I said before that I'm going to leave my email address in the chat. Let me do it now. And so I'm going to email everybody a copy of the permission to record, because I do not have it with me, but I'm going to put my email in here, and if you all could just email me so that I have your email address, and then I'll send a joint email sending you the proper paperwork that I need all to sign, and then also an evaluation, because this is an assignment for me that I am being graded, that's being graded for me. And so you all are not being graded, you all are not being penalized for anything at all. It's all totally me. Like, I'm the one being graded for this because I am in a program where I have to practice teaching and learn. So, hey me. All right. Let's see. So before we get started with diving super deep into talking about solution focused therapy, I want to play a game. It's very simple, not going to take too long. And so it's using the app Kahoot. So if you can let's see, let me put the website in the chat, and then everybody can get to it from there. And then, yep, there it is. All right, so you should see it in the chat right now to everybody. the website, you should be able to just click on it or copy it and paste it into whatever web browser you use. And then once I know that everybody has that, I'll share my screen so that you can get the game PIN number, and then we'll get started. And so it's 5 questions, super simple. Don't feel so much pressure like, oh, I need to get it right, because you don't have to. It's okay.
Venetia,
Yes.
did you say you put a, oh, okay, I see it. It didn't show up as a link. It's just a word.
Okay, yeah, so you should, so just copy it and paste it into your browser. That should work. And then like from there, like once everybody has it, I need you to unmute yourself through the next part of this. So that way we can kind of have some dialogue, things like that. All right. And if you're not able to get to it because you're driving or something, it's totally okay.
You're going to provide a pin?
Yeah, I'm going to provide it. I'm waiting for everybody to, I'm waiting to know that everybody is at the, is added. Okay, you're added. Let's see, Grace, Tiana, Tina, you okay. Ty is added too. Awesome. All right, so let me share my screen. All right, so there is the game pin. All right, we got Grace. We got Tina. We got Tiana. Andrea. Ty. Is that it? Is this 5 people? All right. Y'all ready to get started?
Yeah.
All right, let's get started. So what is SFBT? All right, so if you can't see, you only get 10 seconds to answer the question. And I probably should have explained this in the beginning. So I do apologize for that. So let me take a few minutes, just a few seconds to explain this. So a question is gonna pop up. You're gonna have like about 5 seconds to read the question. Then after that, on your end, you're gonna see shapes. And so based on what you see on the screen, with where the answer is, press the shape that correlates to the answer. All right, y'all got it now? I so apologize because I should have explained that. All right, I kind of need to know that everybody got it. So, because I can't really, okay, let me do.
Let's try it again.
This. Yes, so we're just gonna go to the next question. Okay. I'm so sorry, but okay. All right, so hey, Grace got that one.
All right.
All right. So now this one is very simple. Problem solving and solution building are the same. Diamond for true, triangle for false. Awesome. The answer is false. Nice. I know it goes by so fast. It goes by so fast. All right. So let's go to the next one. Well, all right then, Grace. All right. So for SFBT, you need a diagnosis. Yes, the answer is false. All right, so even though just, you may not know, you don't have to know the answers to the questions, just, just for fun, just go ahead and pick something. All right. Another true and false. SFBT focuses on the past issues to understand the present issues. The answer is false. And so we'll go back and we'll talk about all of these once we're done. All right, and the very last question. SFBT can work with multiple populations. Yes, the answer is true. All right. Yay. All right, so of course it gives like a, thing of like who won, who was in first, second, third, things like that. So yay, Grace. Yay. I don't have any gifts or anything, but thanks for playing though. All right. So I'm going to stop sharing. So first, before I get started with actually talking about these questions, what did y'all think about it?
About the questions and the
Mm-hmm.
Being new to theory, I think it was just trying to again try to tie in what we're learning and just try to tie everything in. So some of them were like, "Oh, really?" But some of them were like, "Yeah, that makes sense."
Yeah.
So
Okay. Awesome. Thank you, Tiana.
I missed everyone else's introductions, but you had said like we were all in different parts of the program, so it just may help that I've taken the class. I don't know if everyone else has taken the class on theories. And I didn't know all of the answers. I mean, it was 50-50 guess. But I mean, I love playing Kahoot. It's fun.
Yeah, awesome. Thank you, Grace. Anybody else?
This is Ty. The questions were fine. It was just like if you're on your phone, you'd have to toggle back and forth between Kahoot and your screen, and I couldn't do it fast enough. So that's what happened to me.
Oh, okay, got
it. Worked,
it.
yeah, it worked
Got it.
better when you
Okay.
read. If you would read the question and then tell us the shape, that I could have
Gotcha.
played. But otherwise, though, the questions were good. So
Okay, all right, got it. Noted. Very much so. Thank you. That is something that I'm actually going to write down.
oh, I'm just I didn't answer any, so I was kind of ashamed. So I had to let you know.
No, oh, you are fine. Look, this is all a learning experience because I mean, using technology, that's not something that I thought about with, somebody who's on Zoom using their phone. So, that's definitely something for me to consider when doing things like this. So thank you. That definitely helps.
Oh, you're welcome. But I just said it for me. I was like, Ty, you know the answer. And every time I got ready to do the answer, I couldn't hit true or false and it was done.
Got it. Okay. Gotcha. Yeah, but I mean, hey, like I said, it definitely helps. And maybe next time I'll include more time to answer the question, so that way I can read it aloud and then tell and then actually like talk about what the answers are for each shape. So did anybody else want to give any more feedback about the Kahoot, the questions, answer, and just like that whole process?
Yeah, that was my experience. On my browser, for some reason, I couldn't see what was true or what was false.
Okay.
But overall, good questions, good insight. Yeah.
All right, thank you.
And same for me in the beginning, I just had to figure out what was needed, what I should be doing, going back
Yeah,
and forward. So once I figured it
yeah.
out, it was good.
Okay. All right. Thank you all for that feedback. Like I said, I've taken note of it and written it down, and I will definitely make sure I allow for more time and consider people using their cell phones. Because for me, I'm always used to using my laptop and having my cell phone. Excuse me, having my cell phone to the side. All right. So let's actually go in and talk about the questions, and this is part where where Dr. Clark, you can kind of jump in and help me with it. All right. So the first question was, what is SFBT, or solution focused behavioral therapy? And so the answer is that it's more goal oriented and focuses on solutions rather than problems. And that meant to say, like, rather than problem solving.
So one thing I want to say about this is a lot of theories take a problem or an issue or a concern, presenting issue, whatever clinical term you want to put. They look at what's going wrong or has gone wrong, and they say, where does that come from? What do we need to heal from it? What do we need to explore about relationships in the past, your childhood, your upbringing, your family, your dynamics, whatever? And let's address that. Let's find connections. Let's find meaning. Let's figure it out. This theory is not about that. This theory is about saying, okay, you have this issue, these concerns. What are we going to do about it? What's the future look like for you? It doesn't disregard the problem, but it reframes it around the future and what someone can do with it and about it in the future.
And I concur that it's really more about the goals for the client and what they're like what they're gonna do about it, not what we can tell them to do, or focusing on like where the problem started, or how and then like everything that led up to, oh, now it's a big huge problem. It's more about, like, it's more of being in the moment, being present. And so that's one of, for me, one of the most fascinating things about the theory is that it's really more about the present moment in the future moments. And so that's just, really good to take note of and to know. All right, so the second question was, true or false, problem solving and solution building are the same. And that is false, because they are totally different. Um, Even though they, people may think that, oh, they're the same, because if you're going to find a solution, then you're problem solving. Not exactly all the time, because, I may be able to find, because problem solving is like, okay, this is the answer. It's, it's done. But solution building is more about, okay, like maybe making small objectives to reach the ultimate goal, rather than saying, okay, how we, what exactly is that thing that's going to fix the problem? Because a lot of times with problems, there's no exact thing. All right. So, Dr. Clark, did you want to jump in and add something?
Yeah, no, I think that covers it. I think problem solving tends to focus on problem centric kind of methods where you're like, okay, what are we going to do? And solution focused, maybe it doesn't have to be focused on the problem, right? It can be finding solutions, finding things to do, resources, strengths to address that aren't necessarily directly related to the problem or whatever comes into the session. So.
All right. So now let's move on to the third one, I'm sorry. True or false, for solution-focused behavioral therapy, you need a diagnosis. And the answer is false, because with SFBT, you don't need a diagnosis, because most times when you're going with the diagnosis, you're then going to try and go into the past and think of like, how did this come about? How, did this happen? And so it's really more focusing, like we said before, focusing on the here and now with the person, and, what can they do to better their lives at that present moment? Like, what do they need in that present moment? And so with the diagnosis, like, it really doesn't exactly matter, because even for me, like, if I'm somebody, coming to one of you saying, hey, like, I've been depressed all my life, and, I don't want to be depressed anymore. And I really need to get rid of this. Well, if you're a solution focused therapist, then it's going to be more of you trying to get me to find the strengths in those moments when, when I wasn't depressed, so that way I can move on, in my life, at least for the now, and not be so, and to at least alleviate some of those depressed feelings. um yeah. So, diagnosis really isn't needed, because I mean, some people come in and don't really have a diagnosis. It's just that they need resources or they need help with something. It just really kind of all depends on the client and their presenting situation.
And it's kind of a provocative statement, right? To say that the diagnosis may not be needed, because in some states, in certain settings, certain clinical settings, you have to diagnose. So the idea that diagnosis is not needed, it's like, what do you mean? The theory doesn't require it, but that doesn't mean that your setting doesn't, or insurance companies doesn't, or, but theoretically, it doesn't look at the pathology of what's going on. It looks at, okay, we're not going to say we have these set of symptoms, right? Because again, that's problem focused. It's, all right, what set of resources do you have to look for in the future? And I worked in one of my practicum settings when I was a master's student. I worked at a community mental health setting where they didn't believe in doing much diagnosis, because they didn't have to. They didn't take insurance. So I was trained somewhere where I didn't diagnose. And certain states, actually, there's 3 in particular where diagnosis is not part of your scope of practice. And so I'm getting too far into diagnosis there, but this is a theory that doesn't require, or doesn't tie directly to the diagnostic process. If that makes sense. And just so y'all know, we will have plenty of time for questions about all this. And we kind of did an agenda at the beginning. Right now, Venecia is going over and kind of her didactic piece and teaching. We'll do a role play, she and I, and then we'll have plenty of time for questions and really, really going over this theory from your perspective and your questions. So just want to throw it out there.
Yeah. Thank you, Dr. Clark. All right, and so the next one, true or false, SFBT focuses on the past issues to understand the present issues. And, we kind of already covered that, with solution-focused therapy, it's not about, how the problem got started, or, what happened in the past. It's more about, what's going on in the present, and how you can find help or get help in the present moment, how you can get those resources, how you can make your life, a little bit better, from, where it is right now. All right, and the last question. SFBT can work with multiple populations, and that is true. So literally, Dr. Clark, he works with children and adolescents. That's, a whole population, in it, in itself. And I work with substance use and addictions. And so, solution focus works with that as well. And then of course, in the research, it shows that it can work with individuals who have experienced trauma, individuals who've experienced depression, anxiety, because it's really more, like I said, it's really more focused on what's going on in the moment and kind of helping to give them a solution in the moment, and providing them those additional resources. So this is one of those theories that it really can work for more than just one population. It's not just, oh, only just this one and that's it. And not saying that it works for every population, because there are just some that it just doesn't. But especially if you have like maybe somebody who has maybe severe psychosis, like, that may or may not work for that person depending on where they are, and if they're on any type of medication. It really truly just depends. But this is really one of those theories that it stretches across many populations. All right. So I'm just gonna, stop and give a couple of minutes if anybody has comments or questions so far.
I think you kind of mentioned trauma with all of those populations. Does this SFBT, does that work with trauma populations? And I guess I'm trying to figure out how.
Okay. Sure. So like I said, it's so because it's goal oriented, especially when you're just meeting with somebody and you're trying to figure out, what they want out of the therapy, what do they want out of, talking about their trauma. That's, kind of the building of it. And then along with it, with a solution focus, there are certain questions that you can ask, like, like miracle questions, scaling questions, and then like follow-ups for those questions. And so even for somebody with trauma, it can be simply you asking, what was your life like, or what would life be like, if you never had trauma, if this trauma experience never happened to you, how would your life be? And then on a scale of 1 to 10, how is this trauma affecting you? And then like they may give you, oh, it's like a 3. Then you say, follow-up question, why is it a 3 and not a 4? And so it's really just kind of getting them to kind of come out of the negative and be more in the positive, and seeing, kind of like what I was saying earlier about there being a light at the end of the tunnel, and that they don't have to stay in that trauma for the rest of their lives. And so that's a part of giving them that hope. And even like that resource of, okay, I kind of do have some skills or some things that I can do to where I'm not in this trauma space anymore.
And I will say, I am a trauma-focused clinician, and I'm trained in eye movement desensitization and reprocessing, EMDR. If anyone's heard of that, so my answer to your question, Grace, is it depends. Solution focus can work really well in conjunction with other theories, as we've said. And so I do EMDR where there's a lot of scaling questions. It's called subjective units of distress in EMDR lingo. But essentially you ask throughout treatment, where are you at in 1 to 10 in how bad this is? It's sort of like that pain scale you get in the ER, like when you're having an injury. Scaling questions are part of it. Resourcing is very much a part of trauma focused work, where you say, okay, in the future, what are we going to do when you're triggered by something or activated, or something comes up that reminds you of your trauma, or, activates this or that memory. So solution focused work helps clients and people work with, in the future, how they're going to handle the stress. But the healing part, that there's not much in the literature in terms of what solution focus can do. Now, the hardcore solution focused therapists will say there's no issue that SFBT can't conquer, it can't address. But there's just not enough to back that up at this stage. Does that make sense?
All right, any more questions? All right, so seems like there are no more questions at this time. So me and Dr. Clark are going to demonstrate for you solution-focused therapy. And so he's going to be the counselor, I'm going to be the client. And so make notes and just, certain things you see. So for the two of you that are in the theories course, just, go through everything that you saw him do, even though you may not know the specific name of what he did, but, still pick out those certain things that you see him do, and even how I may react to it. And then for those of you that are in practicum and internship, and even in the CES program with me, kind of dig into it a little bit more with more of, those skills that you see him actually using. And if there's anything that you would have liked to see done or used more. All right. So if everybody could turn off their video, because there should be a way where it should just show me and you.
Speaker view. No, I think if I just go to speaker view, I can just see you. Okay. All right, so we will do roughly 10 minutes. It's 6:20 here Eastern, 10 to 15 max, and then that'll give us time for processing and questions after. And see what the idea, maybe we'll do some practice time, but we'll see how it works out. Okay. So let's pretend this is not our first session. Assume we have intake time. We've developed that. I know what's going on, the basics of what brings you in. So let's pretend this is a few sessions in. So, All right. Okay. Hey, Venecia, how are you doing today?
I'm doing okay.
Yeah. So what would be most helpful for us to address today?
I think addressing like my mom being controlling. Like it's just it's really at the point of being overbearing right now.
Your mom being controlling. Yeah, that sounds like it must be hard.
Yeah, it is. I mean, I'm 16 and, it's not like I'm asking a lot of stuff. I'm just simply like, okay, like, I want to go and spend the night over at my friend's house, or, I want to go to the movies. I want to go to, out to eat. And, I make good grades. I'm not skipping school like some people. Like I go to school, I'm doing all these things. And it's like, my mom's like, no, you can't go. And I'm like, are you serious? Like, I'm a good, I'm good. And I just don't get it.
Yeah, so you're frustrated and you just don't get it, how your mom is controlling, and you feel like you deserve more freedom, it sounds.
I do, because all I do is I go to school, come homework, thankfully I can have a cell phone so I can at least talk and text to my friends, be on social media, things like that. But then it's like, like when we have church, I gotta go to church, which I'm like, okay, I like church, whatever, that's fine. But I mean, I want to be able to do more stuff. Like, I'm not out here having sex. I'm not doing drugs, because that's not stuff that I'm even interested in. And I just don't understand why she's so controlling and just overbearing. Like, oh.
Yeah, it sounds like she's really got you feeling all sorts of ways, right, with her being overbearing. I see it in you when you're talking.
Yeah, and I wish she would trust me. I
Mm.
wish that she would trust and know that I'm not out there and do stuff that all these other people are doing. Like, that's not me. I simply just want to live my life because this is my life.
Okay. So I want to ask you kind of a weird question, because it's not a typical question you hear every day when you're talking to friends and family. But I want you to imagine you go to bed tonight, and overnight you're asleep, and you're dreaming. Overnight, while you're asleep, something magical happens, right? And all of your problems, all of the things that you're struggling with, especially what you mentioned today about your mom being overbearing and all of that, it's just fixed, right? While you're asleep, it's a miracle. It just gets fixed, right? And then you wake up tomorrow. Obviously, you don't know that happened because you were asleep. How would you know the miracle happened? How would you know when you woke up or at any point the next day, tomorrow?
Well, I think, number one, take me to that time because that's what I want.
Mm-hmm.
But I think, if I, was to let's say, the night before, me and my friend Jessica, we're texting and she's like, hey, um, football game is tonight. Ask your mom if you can go. And then of course, I'm having this whole conversation of no, she's not gonna let me. Then, just to say, okay, wake up in the morning. And I just kind of would wait to that right moment where I'm about to get out of the car before before I walk in to go to school. And just be and so I would ask her can I go to the football game? And if she says yes, I'm going to know God came down from the heavens and touched her and said, let her go to this football game.
Mm-hmm.
That for me, it would surprise me, but that's what it would look like for me, is that the things that I asked for, which isn't much, she will let me go and let me do those things.
She will let you go. Okay, so you would know that moment when you asked her about the football game. That's how you knew. That's how you know that miracle happened.
Yeah, definitely.
When does she say you can go places?
When it's church related. So if the church is getting together and they, and the youth are, with chaperones are going, and let's say we're going to see a movie, but of course, it's going to be one of those movies that's um one of those kind of spiritual movies that they've been coming out with the last couple of years. If they're going to see something like that, or maybe if the whole church is gonna go bowling or skating or something, she'll let me go to that stuff because it's with the people at the church. But if it's something with my high school and with my friends, which I don't have bad friends, she won't let me go. So when it's church people, oh, I can go and be gone all day and she's totally fine. But when it's high school friends, I can't go.
Okay. So it sounds like there's these two categories of if it's related to church or something in that category, then she's cool with it. She says you can go. But when it's not that, she's not cool with it, right? And she says you can't go. Now I want you to think if there's any gray area in between this, right? Where maybe it's something that she said you could do, so that you're allowed to do, that's maybe not in either of those categories. Something where maybe she said you could have some freedom in some way. Any event or memory like that.
Like I do remember when I was in elementary school, like my best friend, like we've been best friends since pre-K. I think we were in like the fourth grade, and she had a sleepover, and my mom let me do it.
Mm.
You know, and so like that was like one of the one of those things I remember her letting me do, because I don't really know why, but she let me do it.
Yeah, so your mom is capable of letting you do things that you want to do that aren't necessarily related to church.
Yeah.
Mm.
But I don't know, like, what the issue is with, like, going to the football game or the basketball game, or like going to the movies or out to eat with my friends. Like, I don't know. Cause like, if the church was going to go do it, then it's like I can do it. But, if I'm not doing something with the people of the church, then I can't go do it now.
Mm.
And I don't know why.
Mm. It sounds like it's confusing to you to understand your mom's reasoning and logic for allowing you or not allowing you to do things.
It is. It is because like she talks about how when she was you know in my when she was my age, like I hear her talking to her friends like, oh my god, girl, you remember when we went and we saw this movie, and these people were around, and like she'll reminisce about that stuff. And for me, I'm like, I want to go out and do those things. I want to have those memories. And like, I don't have, like, I literally have none of them while I'm in high school. I mean, like, I'm 16,
Mm-hmm. Mm-hmm.
you know, like
Yeah.
I'm a good person. I'm a good daughter. I'm a good girl. I'm a good student, you
Mm.
know.
Mm-hmm.
I don't know.
Mm. So when we think about this, we kind of have to look at what you can do about it, what you can do moving forward, because we can't control your mom's choices or what or her perspective on
Yeah.
what you're allowed and not allowed to do. Or unfortunately, we're not in control of her parenting choice there. But
Yeah.
there are things that you can control. So let's think about what your goal can be to address this and to have a plan moving forward, because I get the sense it's really affecting you and it weighs on you heavily. So what does your gut tell you about what you need to do?
You said, what does my gut tell me?
Yeah, about what you need to do.
I mean, maybe just be happy with the fact that, like, I can do stuff with the church. And I mean, 'cause at least I do get to go out. Granted, the church doesn't do stuff all the time, but
Mm-hmm.
I get to go
Mm-hmm.
out and do some stuff. And
Mm-hmm.
I don't, that's kind
Mm-hmm.
of it. I mean, there's sometimes, like, when I want to sneak out and just, go do what I want to do. But of course, like, I'm that good child. So I think about the consequences, because, like, I'm not trying to get in trouble. I don't want to take my cell phone. I don't want I mean, the little bit of stuff I do have, I don't want her to take that away from me.
Mm-hmm. So there's a gratefulness here that I'm hearing that maybe you can work on being grateful for what you can do. But let's say that doesn't work, and in the future you're having a hard time being grateful because she's not allowing you to do something you want to do. What can you do with that?
Um, like maybe if I can, like, explain to her, that, like, who I'm gonna be with, where we're gonna be, not change locations, or say, hey, why don't you come and chaperone with us?
Mm-hmm.
You know, maybe then she'll let me go, because then it's like, hey, you're here with us, like, you know, you don't have to like sit with us, but, you know, sit where you can see us.
Mm-hmm. I noticed this is the first time we're in our session today where you talked about addressing her in a productive or proactive way and communicating with her, right? Rather than reacting to the no or the not allowed.
Yeah.
You just talked about communicating with her. Can you say more about what that communication could look like?
I mean, just like, you know, my mom, like, she's all about, you know, facts, and she's about safety. And, you know, and maybe that's why, you know, she keeps saying no, because to her, with all the stuff that's going on in the news, she's kind of like, no, I don't want you to go and do those things. And she doesn't exactly say, which is why I don't know why. So I'm just kind of like, you know, thinking like maybe that's her reason why or something. But you know, I would sit down and like, you know, talk with her, you know, give her like straight facts of like, you know, where we're gonna be, you know, what time the movie is that we're seeing, how far away the restaurant is that we're gonna go to like after we're done, you know, to go eat, and then like about what time we'll be done. You know, I mean, and like I said, and then, you know, to like maybe make her comfortable with letting me go, to invite her, you know, and say, hey, you know, come along with us. You know, you can like sit to, like if we're at a movie, you can sit 2 rows back, you know, so that way I still am with my friends, but you're there watching me, you know, and or like, you know, we go to basketball game, football game, like you come with us,
Mm-hmm.
you know, come to the game with us, and then, you know, you sit behind
Mm-hmm.
while I'm, you know, down with my friends. You see me, you see who I'm with, you see what I'm doing. Like, you know, I mean, maybe to make her comfortable, because maybe she, I mean, you know, she, I mean, I don't know. Like, I mean,
Yeah.
because she doesn't like open up and tell me anything, because she's like, you know, I'm the adult and you don't need to know why, which I've never, I don't understand that, but whatever.
Mm-hmm. Yeah, no, I like the specifics you're providing though about what that conversation can look like. And I wish I could tell you whether that's going to work or whether that's going to help or not. The fact is, we don't know what she's going to do. We're not in control of her as much as you'd like to be at
Yeah.
times. So
Yeah.
thinking about that conversation, that's a great strategy, I think. But what can you do? Let's say it doesn't go the way you plan and she says no. What kind of resources can you draw on to help you deal with that moving forward?
I don't know, because I mean, at that point, I think I've exhausted all my options. Like, I
Mm,
don't know. Like that, I don't know.
mm. Do you have friends you can reach out to?
I mean, yeah, like I can reach out and talk to my best friend. You know, we have other friends, um, that, you know, I can like talk to, whatever. But
Mm-hmm.
I mean, like, I don't know, because
Mm,
I mean, at that point, if she just says no, then it's like, you know, she really does not trust me.
mm,
Because I mean, I just want my mom to trust me and to know that like I'm not gonna be out here doing drugs and having sex and, you know, fighting people and shooting guns. Like, I'm not gonna do those things. And yes, I know those things exist. I'm 16. I've been taught about drugs since I was in elementary school, been taught about sex since I entered high school. Like, I know those things exist. I see it on TV. I hear it in the music. I know all of these things exist. It's not anything that I'm interested in. Like, she
mm-hmm.
knows the things I'm interested in, which have
Mm-hmm.
nothing to do with sex and drugs.
Mm-hmm. Okay. So let's think about this solution we have in place in terms of communicating with her that you want to be trusted, and you want her to trust you, and you want to offer some options for her. Um, a scale of 1 to 10, one being zero confidence, or sorry, yeah, one being no confidence, not zero because zero's no, and 10 being like, oh, this is definitely very confident. This is going to help.
Mhm.
How confident are you that this is going to help?
Like maybe a 3.
Okay. Okay, so you're a 3 in terms of confidence that this is going to help. So say a little bit about that.
I mean, I know my mom, and like since I was a freshman in high school, I've been asking and asking and asking her to like go places, and she always says no. And she never, of course, gives the explanation of like why I can't go. So it's like, yeah, I could try this, but I don't have much confidence that, me inviting her out with us could work. Yeah, I don't, because I mean, based on like, how she always reacts, like I don't know. Like, I mean, it could work. I mean, because if it does, it's a miracle. If it doesn't, then it just kind of then it's just like, I know it wouldn't.
So what I'd like to do is next session, I want to look at this and let's leave the options open for how this will go when you talk to your mom, talk to her about trust, offer some solutions. And however it goes, I want to touch back with you and touch base in terms of about what can we do that you'd be more confident that will help, right? If it doesn't go as you would like, because we can't control her, what can we do? What can we control? And how can we increase that confidence that, we have some solutions here that will help? Because the thing is about solutions, we don't know what will work, what will help the most until we do, right? Until we do it. And so we have to explore. And so we have to be open for different possibilities there. So I'd like to continue with this at the next session. Does that make sense?
I think so. So like, do you want me to like ask my mom? Like
Well,
you
what
want
do
me to
you?
do that? Like,
Yeah.
want me to do that?
Well, what do you think? I'm not the expert of your life. I want to ask, what do you think you need to do?
Yeah, I'm not ready to ask her that. Like, I just know, because
Okay.
I don't, for me, like, I'm just afraid that, it's gonna be rejected, and she's gonna be like, no, and don't ask me again, and no, and I don't want to go through that again.
Okay. So you're not ready to ask her.
No.
Okay. Okay. So what are you ready to do?
Nothing.
Nothing. Okay.
I just, as frustrating as it is, and I want it to be over, it's like, I'm not ready to do that. I just, maybe after the next session, I'll be ready. Like, I don't know. I'm
Okay.
just scared. I'm scared of her reaction. I'm just so scared of her reaction, what it's gonna be.
I get that. You're scared. This is a pattern. I mean, and it doesn't come from nowhere. So to break that pattern moving forward, something will need to happen. But you're the expert. I can't tell you what the solution is or what to do, but I can support you in your choice and what you do with it. And so one thing that I will ask you to consider is how doing nothing serves you, right? Or maybe doesn't serve you. And we can explore that the next session in terms of, if you consider that idea, and we can kind of see where it takes us. Does that make sense?
Yeah, that makes sense. Yeah, I got it.
Okay. All right. So we'll pick this up next time. Thanks for coming today.
All right.
Bye. And scene. All right. Yeah, that went over what I anticipated. It was like 23 minutes, but I wanted to have like an arc of what was happening, because with these role plays, sometimes it's just like, all right, done. And I wanted to kind of show how these it's not like a lot of solution focused examples are like, why don't you try studying in your room to get a better grade in your class? And they're like, I'll try
Yeah.
that. It worked. Thanks. Bye. Like
Yeah,
it's not,
yeah,
not that
it's not
formulaic.
cookie cutter. It's
Right.
not cookie cutter like this fits here and that fits here. Like no, it's definitely more free flowing.
Mm-hmm.
But all right, so let's open this to the Zoom for everybody to talk about what you saw, what you experienced, what were some things that you that you kind of caught on to and you pointed out.
I personally enjoyed it. I know role playing can be very difficult. So I enjoyed watching it. What I noticed was that he never gave you a solution. He kind of tried to let you figure out a solution for the situation in the beginning. It was more of a restating of what you were saying and then pausing and letting you kind of go from there and talk about it. But it was a lot of patience, I would say that, and kind of letting you talk through what your issues were. And then towards the end, trying to make you see some positive out of it and kind of try to stick on the positive side rather than, the main problem, which was your mom. So that's what I got.
Definitely.
Yeah. And it's hard because this is not, counselors are not advice givers. We're not in the business of telling people what they should do. And as she's describing, Tiana, what's going on, there are times where I'm like, in my mind, I'm like, you need to talk to your mom. You need to like talk to her from a place of like trying to connect and tell her how you feel and lead with I statements and do these. You should do this. But if I tell her what to do, best case scenario, that helps. And the next problem she has, she looks for someone else to tell her how to fix it. Right. Worst case scenario, it doesn't work. And she's just back with another person telling her what to do. And she doesn't need that in her life.
It's interesting because sorry.
No, go ahead.
My thoughts when you started bringing up your mom and first it was the first sleepover you went to, and the thing in me wanted to go, well, did something happen at the sleepover that makes her, not want to allow you to go to another sleepover? And then when she was talking about the things that she did as a child, I was like, well, maybe something happened. But solutions driven is not about bringing the other person in, but kind of staying in the moment right there of what's going on with you, not trying to bring other people in. So I enjoyed that.
Yeah, because even for me, the thing is like, had he given me of, do these things, do these things, use I statements, talk to your mom, things like that. And so let's say I did all those things and it didn't work. And now remember, it's a teenager, somebody who's 16. They're like right smack dab in the middle, almost about to be an adult, but not there yet. So literally, and especially my experience with adolescents, you tell them, hey, go try this. And they come back and they say, it didn't work. It's your fault. You told me wrong. And so then they go to blaming the counselor. And that's, one of the reasons why, we ask counselors and clinicians, we don't give advice. We don't give answers. We allow them to find their own. And even when we have those clients that'll be like, what do you think about this? Or, like, what's your professional, I've had this asked so many times, what's your professional opinion? And I say, my professional opinion is that you're the expert in your life and you can find the solution to this. And they're like, but I really want to know what you think. But, and then you really have to flip it back to them so that they can gain that confidence in themselves, and that's a part of, kind of what solution focused therapy does. It gets the person to understanding and really finding the confidence in their own abilities, and it's that belief that everybody has those resources to be able to find solutions and find resources to help them. All right, anybody else want to talk about what they saw, the skills and techniques that were used?
I thought it was awesome as well. I like that Dr. Clark acknowledged the present in the moment. Like, he acknowledged your face expression and, the aggression in your tone and things to see how, it was really affecting you. So I think it's always great when we can acknowledge where people are in the moment. So keep them centered. I thought that was great. And I also like how some of the others have pointed out already, he didn't try to give you a solution. He let you figure it out on your own, which of course is most important. And I think it was Tiana or Todd just now pointed out a very good important notice. Forgive me, you all. I'm on Tylenol 3. But
It's all right.
with these stitches is horrible. Forgive me. Trying to get my thoughts together. But I like that she pointed out. And I lost my thought. Okay. But anyway, I thought it was really good. And thank you so much. Oh, I know what it was. That although your mom, because I was with her thinking about things that could have transpired in your mom's experience as the reason why. And that's what I was liking, like thinking, I wonder, should we think about that or maybe introduce that or ask questions, explore that is what I'm trying to say. I wonder, should we explore that? But then, of course, with solution focus, like she said, it's about you and it's not about trying to figure out what the dynamics of your mom and other people. So thank you.
Yeah. All right. So now, Tina, because you're in practicum or you're getting ready for it, I need you to give me a skill. What specific skill did you see from that specifically solution focused therapy?
All right, so you want me to name it, right? I feel like I've said a couple things already.
but specifically from the ones that we named, like what, because there was like definitely a couple that he used.
All right, well, I'm gonna tell you right now, if I haven't said it, you're gonna probably need to help me out, then I can take away
It's okay.
from more
It's
focus.
all right. So when he asked me, when he had me like what if wake up in the morning and everything is fixed. So what kind of question is that? What skill was that?
I don't know. I guess because I'm on the spot. That's how I am with tests.
It's all right. It's all right. Does anybody want to jump in and help her?
Isn't that the miracle question or something you were
Yes, the miracle question. Yes.
Okay. See, I'm unfamiliar with the miracle question.
Okay.
I never would have gotten that. Now, where did I miss that?
I mean, and so think of it as like, when we're like, oh, if only there was a miracle to like help all of this go away. That's the miracle question.
Gotcha.
And a lot of people don't even realize that it does come from solution focused therapy, or even, I'll go ahead and throw another one out here. The scaling questions, on a scale of 1 to 10, 1 to 5, like that's a part of solution focused therapy. So I mean, and of course, you definitely gave, some other things, but that was like one of those key things that I was like,
yeah, see, I get to take away from this now. I feel more empowered and solution focused, knowledgeable.
Awesome.
So thank you. Yeah, the miracle question, scaling. Okay, what else he got for me?
All right then. Anybody else want to share what they saw, what they any techniques, any skills?
I had a question. This is Ty.
Go ahead.
So one thing I might have missed this. I was of course ordering food earlier, but one thing was I heard that you kept saying you were a good girl, right? However, if in solution-based therapy, what if one of your solutions was, well, I'm going to run away if she doesn't do this? So how would the clinician? I know we don't do a lot of steering. I mean, you steer, but how do we? If it seems to be an unhealthy answer, like what are the steps? How would you steer that for both of you?
So for me, I would then, ask or, say, I'm curious, as to how that would, help the situation. And then kind of let the client process, like what running away would do, and then like really, and really, get them to think about, what they think are the rewards or the positives, and then also kind of get them to think about, what the consequences or the negatives may be in that situation. Because again, this is their solution, and with the solution, you want them to think about both sides, the positives and the negatives, the rewards and the consequences.
Mm-hmm. And I would also, in my view, all right, let's talk about what that future looks like. It's let's talk about what that would do, what the dominoes are with that decision. And how does that serve you? I come back to that a lot when counseling. It's like, how does this serve you to do nothing when you have this idea of communicating with your mom? Or how does it serve you how would it serve you to run away? Like, yeah, you may avoid those uncomfortable conversations with your mom, but what else would you have to deal with, right? So it's like, it would integrate other theories by doing that, but I think that's important to do.
That's what that's what I got, that I would do some more. So like highlight and open and like talk about both of those. But from a legal standpoint, because she's 16, wouldn't I alert the mom, or what? Are we supposed to do that? Because she was 16, right?
Yep.
Okay.
Venecia, what would you say to that in terms of?
I mean, like, now if she said at the end of the session that that's what she was going to do and that was going to be her solution, I probably would alert the mom, just to not say, and to be very mindful of, look out for her and keep her under, tight hold. But to, bring in, these were some things, that she discussed, not going in complete detail about exactly what she discussed, because again, that 16-year-old is my client. And so I don't want to give away everything, but just to maybe say, like, there's some concern with, her reaction to, to how you are, how you are approaching her wanting the freedom, and just to, maybe help mom open the conversation with her daughter so that they can have that conversation, rather than saying, she's talking about running away and, you need to be mindful of that. No, because again, the 16-year-old is my client. So just saying, I am a bit concerned of, what her solutions may be with this, and that, it, could be a good idea for you to open the conversation of, what's going on with her, and just to kind of see where she is, what she's feeling, what she's thinking, to then try to like reach the conversation, but letting the client really do more of the work rather than me just giving it all to her.
Mm-hmm.
Okay, that's what I was thinking. But as a new student, it's like we're learning everything, and I hear like I saw different techniques you guys were using. But being new is like I can't wait till I get my superpowers of being able to navigate through all the different theories, because I was like, I don't know if I can do this. I don't know what's going on. Anyway,
Ty, it takes a minute. So this is just for you to be introduced to actually seeing how theory works, because the thing is, right now you're learning it from a book, but with this session you're now getting a chance to see a theory that you're learning about actually be applied. You're seeing the application of the theory. So don't be afraid and be like, oh, I gotta have all of these theories, because the thing is, especially when you graduate, you don't, and you can ask a lot of the professors, when I guarantee you, when they graduated, they didn't have every single theory understood. It took time, and it still takes time. So, this is just to show you how to actually apply theory, and that it's not as hard as you actually think.
Well, that's comforting. I got where you were going, and I understood. I was just verifying that if she was 16 and she said something like that, then that is my responsibility, because that's what we did in the first class. So thank you. Thank you for the demonstration. It helps us new people see.
Of course. And of course, glad I can help. I totally understand, because I didn't have this when I was taking that course. Like, we had to stay in videos, and that was it. So hey, new day, new things. Awesome.
Yeah.
Anybody else?
All right. I want to be mindful of time here for those of you. It is already 7 o'clock, or Eastern, wherever y'all are. But
6 o'clock
thank
for
you.
me.
Yeah, 6 o'clock Central. Thank you for coming to this theory troupe. Really appreciate your engagement, and to see you all here. Hope that was helpful for you to kind of see what this looks like in practice. And like I said, feel free to reach out to me if you have any questions or want to touch base on anything.
And feel free to reach out to me as well. And so I'm gonna give this a few seconds, because in the chat room I put my email address. So I already got one person who emailed me. Yeah, I do not know. Dr. Clark can answer that better than I can.
Who's your instructor? I mean, I think for this, you would have to check with techniques if that's the thing. Grace, were you
So, most of the time for like the town hall and all of these things, and I would touch base with Colleen. Colleen will pull attendance. And that's how, and then she will inform your professor that you attended and the number of points that should be granted. That's how they've done it in the past for the virtual conference. I can't guarantee that's how they're going to do it, but that's what they've done previously.
Yeah. But my email is in the chat. I need every single one of you to email me, so that way I can send out an email to all of you with the proper paperwork that I need you all to fill out, as far as like the permission to record and the evaluation once I get it.
All right.
All right.
Thank you again. I really
Thank
enjoyed it.
you
I learned
all.
a lot.
Thank you all for attending. I had a great time. So
Thank you.
Thank you.
Y'all have a good night.
Hey
and
guys.
I think that was me who emailed you. Did you get my